Hello, my name is James Farmer. In June and July 2008, I went to India to make this documentary on Lepra Health in Action, a charity that runs healthcare projects in the poorest parts of the world. One patient of lepra is Balaji Daravath with his parents Venkatesh and Vijaya, who are both HIV positive. Vijaya's first two pregnancies ended in the death of her babies because she was not receiving any treatment for her condition, and private doctors refused to deliver the baby due to her HIV positive status. When Vijaya became pregnant for a third time, she came to Sriyasu. She was registered as a patient and started on ART drug treatment, nutritional supplements, and given counselling. During the pregnancy, she had regular follow-ups, and the centre facilitated an emergency ambulance service and a hospital delivery. Vijaya and Balaji were also given the drug nevirapine at the time of birth to reduce the chance of the HIV virus being passed from mother to baby. Balaji was born HIV negative, and the family was provided with all the essentials for a newborn baby, as well as continued care and support from Sriyasu. Another disease treated by lepra is Kala Jar, or black fever. This is a disease spread by sandflies that live in the mud walls of people's houses. The first sign of this disease is a fever, so many people do not seek medical attention. As the disease progresses, the skin blackens and the spleen expands, leading to a swollen stomach. Left untreated, the disease is fatal. Lepra works to make the symptoms of this disease common knowledge in the community, to encourage early detection and treatment. As well as the testing, physiotherapy, self-care exercises and ulcer management offered to leprosy patients, lepra's prevention of disability program extends into other diseases, as with the case of Shashida Prasad. He has lymphatic filariasis, a disease spread by mosquitoes which results in abnormal fluid retention. The effects of the disease cannot be completely eradicated, but these cleaning practices can prevent infection and worsening disability. After suffering from the disease for 30 years, in the 4 months of treatment Mr. Prasad has received, he has had a 30% reduction in the size of his leg. In the village of Chungudisar, I met cured TB patient Pramila Pradhani and her DOTS provider, Subhamani Pal. DOTS stands for Directly Observed Treatment. In this scheme, a volunteer is selected by lepra to supervise the treatment of TB patients unable to access centralised healthcare. The medication is kept at the home of the DOTS provider, and the patient is given a timetable of visits to take the medication. The DOTS provider ensures the medication is taken in the right way and at the right time, tracks down the patient in case of any missed appointments, and ensures the course is fully completed. The DOTS provider is also given education on spotting the symptoms of TB. After Mrs. Pal passed this education on to her patient, Mrs. Pradhani's son referred a member of the village for testing. When the results came back positive, he volunteered to become their DOTS provider himself. Waiting to go into cataract surgery at the MNC Eye Hospital was 69-year-old Mathura Amat. 4 days ago, Lepra's Low Vision Project travelled to Mrs. Amat's village and announced there would be a free vision screening the following day. The message was also spread through local community leaders. After attending the screening, Mrs. Amat was diagnosed with cataracts. A counsellor advised her that she could have a free operation to restore her vision, and she was taken to the MNC Eye Hospital the next day. She received 2 days of preoperative care and examinations before being operated on today. Before the operation, she had been living with low vision for 4 years. She found it hard to do anything around the house and even needed help going to the toilet. Tomorrow morning, the success of the operation will be assessed. She will be given eye drops and advised how to look after herself before being sent home. In 1 week, she will come back for a follow-up to see if, as hoped, her vision has been fully restored. Although cured of leprosy, Ram Avatar still suffers from claw toes and claw hands caused by the disease. He is currently receiving preoperative care before undergoing reconstructive surgery to restore his hands and feet to normal function. Someone who has already had the same operation is Bansing Maggi. Before the surgery, due to the damage in his hands and feet, he was unable to continue his work as a manual labourer. Although also completely cured of leprosy, these outward signs of the disease led to problems with his neighbours. They would not wash in the same place as him or drink from the same well. When his wife suffered the same treatment, he refused to be seen in public with his family, isolating himself to protect them. After his reconstructive surgery, Lepra provided him with an SER, or Social and Economic Rehabilitation, interest-free loan, to start a more appropriate, less physically demanding business. He eventually plumped for 2 milking cows, and from selling their milk has expanded his herd to 9. He is now self-sufficient and provides for his family. With lepra counsellors educating his village about leprosy, and the visual signs of the disease eradicated through surgery, the exclusion he and his family suffered has come to an end.